Good evening, everyone, and thank you for joining tonight's webinar on better understanding H5 avian influenza. I'm Dominic Enter, I'm the project manager at VFF StockSense, and I'll be your host tonight. Just like to introduce the StockSense project before we get into it. It's a project run by the Victorian Farmers Federation. We're funded by the Cattle Compensation Fund and the Sheep and Goat Compensation Fund, and proudly delivered by the VFF Livestock Group. The project was established to help Victorian livestock producers maintain and improve animal health and welfare, as well as Victoria's overall biosecurity status. And we are very passionate about the small landholder hobby farm and those new to farming. And our project in the last couple of years has a key focus on that audience. So if you do know anyone who is in that category and they're keen to educate themselves more around animal welfare, biosecurity, and animal welfare, please send them our details. We do this through a number of workshops around the state. We run webinars such as this one. We also have a number of resources online, and we do have a monthly e-newsletter. So that e-newsletter provides up-to-date information on animal health, welfare, and biosecurity for that small landholder and hobby farm audience. This is how you can stay in touch. And I'd like to quickly mention a couple of other projects within the VFF. There's a Making Our Farm Safer project and also a VFF Farm Business Support project. They're both free services available to all farmers in Victoria. And there's a link there to a VFF membership if anyone's interested. So tonight we're lucky to have a very experienced Agriculture Victoria team who will be giving an update on H5 influenza, avian influenza, and also what producers can do. The schedule, there'll be about a 45-minute presentation as well as 15 minutes for questions and answers at the end. And we'll also try to provide some answers to any questions throughout the webinar. So if you do have some questions, please type them into the box below and we'll try to answer those. Just like to make a note as well that tonight is open to all producers. It's not poultry specific. So if you do have some questions, please do go ahead and ask them, even if they're not poultry related. And a reminder, slides will be sent out via email along with a link to the recording. I think that's about it from me for now. I'll be back at question time. I'll hand over to Beth Jones, the Chief Executive of Agriculture Victoria, as well as Charlotte Austin, who's the Executive Director of Biosecurity. They'll be giving a further update on what to expect tonight. Thanks, Beth and Charlotte. And I think someone said it was your fifth webinar today, so thanks for joining us. I'll stop sharing and let you share your screen.
Good on you, Dominic. Thank you very much. And yeah, welcome everyone. And thanks to the StockSense team for creating this opportunity for us tonight. Just make sure you can, yeah, sorry, you can hear me okay, Dominic?
Yeah, that's
great.
Good to go. Thanks, Beth.
Good. Yeah. So thank you all, Dominic, to you and your team for creating this opportunity tonight. Yeah, we might have had 5 webinars today, but they're important conversations and we will keep rocking up and having as many conversations as we need to make sure people feel like they know what's going on and what's happening in response and connecting you to any information that you feel you need right now. So I've said to Dominic, we'll come back again if there's demand for that. Yeah, so Beth Jones, Chief Executive Ag Vic, and I'm joined by a number of my colleagues tonight, Charlotte Austin, who I'll hand to in a moment, but also our Chief Veterinary Officer, Graeme Cooke, our Chief Biodiversity Officer, James Todd, Sharon Williams, who is the incident controller of a little incident management team that we put together to make sure we're absolutely on the balls of our feet at all times. So between all of us, we plan to give you an overview of what's happening on the ground right now, and talk about sort of what we're doing in response and what it all means, and certainly welcome your questions. As you know, we've had H5N1 bird flu detected in a small number. There's still 5 nationally of individual seabirds, migratory birds. So that's, birds that have kind of washed up on beaches, in quite remote beaches in remote areas. There's been no detections at all in Victoria. There's been no spread that has been detected to native wildlife or any sort of mass mortality events, and certainly no detections in poultry. As the last continent around the world to have H5N1, we've certainly been expecting this and absolutely preparing accordingly for it. We've undertaken a whole range of things that my colleagues will outline a little bit further for you tonight. And I think just before I hand over, this bird flu is quite different to the H7 bird flu that you might be familiar with. Many of you might be very familiar with, that we've had in Victoria in 2020, 24 and 25, that we were able to very successfully eradicate from a few locations. This strain of bird flu is much more contagious. It spreads very quickly, and it doesn't just impact poultry, it impacts a range of birds and mammals and wildlife, for which there are pretty limited options for us to act or manage them. So our response to H7 has very much helped prepare us and make sure we are ready to stand up response. But it is very different in terms of the impacts on wildlife and what that means, and you'll hear more about this as we go on. Regardless of it just being a couple of birds, 5 odd birds washing up on a beach so far, I think importantly what it tells us is that the virus or this disease is moving around us. As I said, we were expecting it. So we are very much sort of thinking ahead and being very sort of cognizant around watching what's happening as a part of a national approach. We're certainly linked in nationally with industry, with the wildlife sector, with public land managers and a range of others in making sure that we are sharing information and looking around, and there's strong engagement around what people should and shouldn't do. Early detection, of course, is really, really critical for any biosecurity issue. The quicker you can respond, the quicker you can address the issues. And we've certainly seen an uptick in reporting. We've been following all of those up, and as I said, thankfully we haven't had any positives. We've had a number of negatives in Victoria, negative test results. But we continue to look around and make sure we're very, across what's happening in the environment around us. So I think that's probably a good segue over to Charlotte, who will talk a little bit about our biosecurity system and the framework we're working in, before we get into sort of the details from our technical experts around what's happening on the ground right now. But thanks, Charlotte.
Thanks, Beth. If we go to the next slide, please. So this is just a little bit, I guess, of a reminder that Victoria is part of a national biosecurity system, and the responsibility to protect Australia from potentially damaging incursions of any diseases and pests, including H5N1, is shared between Commonwealth, state and territorial jurisdictions, and along with industry bodies as well when we do get into a potential response type situation. And as we're currently seeing, the national biosecurity system really is standing up. And this makes sense because with threats like H5N1, a couple of birds potentially arriving in Western Australia does have potential big impacts for Victoria. So within that system, we have got some of the technical experts and the brains that come together in terms of the Consultative Committee of Emergency Animal Disease, of which our Chief Veterinary Officer Graeme sits on with other Chief Veterinary Officers. We've got the National Biosecurity Committee, and then we've got senior executives such as Beth as CE, across with her other CEs, meeting on a very, very regular basis. So I think the key thing at the moment is, even with these 5 birds, the system really is in full swing. Next slide, please. Thank you. So within Victoria, we have some very clear response arrangements in place. DECA, of which Agriculture Victoria is a part of, is the control agency for biosecurity matters such as this H5N1. As I talked about, we've got the systems, forums, plans in place as part of that national biosecurity system. We have learnings from the H7 events in Victoria, which Beth touched on and Graeme will go into, that has really given us pause for a considered preparedness program over 4 key streams, and that's policy and programs, communications, systems, workforce and skills. And in these prepared activities, we've been doing some significant work on things such as a waste disposal strategy for if we do get to a point where we are having to dispose of large amounts of animals. A significant communication strategy, as this is a very complex disease as it goes across wildlife and potentially agriculture sectors, which we will hear about. We've been doing a huge amount of preparedness with our own staff in terms of rolling out exercises, e-learning packages, on-site training. We've seen a large surge capacity in our lab, so we've been able to increase that capability for our testing. We've invested heavily in some mobile lab facilities as well, and mobile trucks to get us out and right at the front of the disease if we do need to be at the front of the disease. We've enhanced our IT systems, including some online permitting and things as lessons from our H7 events. And very, very importantly, we've been doing a significant amount of exercising at the state level, across government, and actually across into industry as well, to make sure that we are ready for large emergency animal diseases to put us in good stead for what may be coming next. We also know that if these events turn into large scale, there can be significant impacts on community. And so with that, we're also putting our minds to thinking about what relief and recovery may need to look like, particularly under the national framework, out into the future. So I think with that, I'll hand over to our Chief Veterinary Officer, Graeme Cooke, to talk about the ins and outs of this current incursion. Thank you.
Thank you, Charlotte, and thank you again to VFF for putting this together. If we could have the next slide, please. We have talked generally about the increasing threat to Australia of emergency animal diseases. There's an increasing pressure, foot and mouth disease, lumpy skin disease, and this is one disease which has very little ability to be controlled at the border, none, because it's spread by migratory birds, and that's how it's moved around the world. It made its way across from the Northern Hemisphere into South America, from South America moved down into the subantarctic region, and it's also been sitting above us in Asia. Last November, we got the news that it had moved into Australian subantarctic territories, Heard Island in particular, and that it was starting to have destructive effects on wildlife, which is one of the characteristics of this virus. It's called H5N1 2.3.4.4b, and that is what makes it different from any other form of H5. Once it has been tested and found to be that, we know that we have trouble. And that is what has happened. We have found it in 5 now long-range migratory birds, petrels and skuas, and they are known to be the means whereby it has moved from continent to continent. So whilst we have been expecting this disease, we now have clear proof that it can reach Australia. The question now, and why so much surveillance is undertaken in WA and South Australia, and is also happening along other southern coastal states, Tasmania and Victoria, is has it had the opportunity to spread into our native wildlife? And as those of you who've been involved in our past avian influenza outbreaks, it is wild birds, native wild birds, that introduces it to commercial flocks. Whilst we've had these wild bird incursions, we remain free of H5N1 in international terms. We only lose that free status if it is found in commercial poultry, and then that would trigger various issues to do with trade and international status. So I repeat, H5N1 has not been found in any of our surveillance samples in Victoria, nor has it been found in commercial poultry anywhere in Australia. But nevertheless, this is a period of real uncertainty, and therefore we wanted to raise the understanding of this disease and what is happening within Victoria, particularly at this time. So next slide, please. As Beth alluded to, we have created an incident management team, but collectively we're working closely with Western Australia and South Australia, really looking at their surveillance, what the results are. We're also contributing to the national effort. There's daily meetings of the Australian Collective of Chief Veterinary Officers, the Animal Health Committee. We are raising awareness amongst members of the public and those various industries that have either poultry industries or have contact with wild birds, really to increase both our biosecurity education, because this is an extremely infectious form of avian influenza, much more infectious than the H7 variety, and therefore it can push its way into biosecure environments in a way that we haven't seen before. Also, we're reminding members of the public to please be part of our surveillance effort and to, first of all, avoid sick or dead birds at this time, unless they are equipped with particular PPE, and there are wildlife rescue units and also our own staff who have that, to record what type of bird they see, where they see it, location is very important, and then to report it to the Emergency Animal Disease Hotline, which is a national hotline, 1-800-675-888, 1-800-675-888, or through the Agriculture Victoria online reporting form, which is found under the bird flu site. And I would invite you, as people who are within the rural community and within the countryside, to be part of that effort. We are interested particularly in any species of bird if it is found in a group of 5 or more dead ones. However, we are interested also in only one of either a wild seabird, long-range migratory bird, petrels and skuas particularly, water birds, shorebirds, or birds of prey. Birds of prey because they are scavengers and they can eat infected and dead other birds. Highly unlikely to apply to VFF, but because we know this has caused deaths and has caused considerable deaths in seal colonies and sea lion colonies, single marine mammals of that type, including dolphins. So we're asking at the moment for people to avoid, but as part of the surveillance effort, to record location, type, number, and then to report it through the surveillance chain, and then a decision will be made if an investigation follows. Could I have the next slide, please? So what happens to this surveillance data? Well, we have actually had a surveillance program in place for many years, a combination of Agriculture Victoria, Wildlife Health Australia, and the universities. As you can see, 1,800 reports since January 2024. And as a result of the awareness raising, we've had an uptick of almost 300 reports. We need more, and we need that to understand the risk. But every day we do not have a positive, that's a good indicator as to what stage of the plan we should move to in terms of rolling out different risk-based decisions. It could be, though, that within days, it could be a completely different story, and we may have found evidence of spread within the native population, and that will take some time. If I could have the next slide, please. And as I said, we've been preparing this for a while, expecting it to come from the north through migratory pathways that come to Victoria. The shearwater migration that comes to Port Fairy and that area is a classic example of that. And it's just a reminder to everyone, we are still in the migratory bird season, and we will be for a good number of months. So vigilance was always intended, and that's been the Victorian way since we started having H7 outbreaks. But now that is sharpened because of the possibility of H5N1. And if birds were coming up from the subantarctic region at the beginning of the winter, we do expect them to come up during the winter. Next slide, please. So what would happen if in poultry farms H7 was detected? Well, H5 would have exactly the same process. So in H7, first of all, we have an initial diagnosis. That goes through the national mechanisms. There's a decision made on the agreed response effort. There then would be operational activities such as depopulation. That's to remove the possibility of onward spread, disposal, decontamination, and then a surveillance effort, keeping the premises under quarantine whilst we move towards effective declaration of eradication and freedom. That is what we would do for H5N1 in poultry, but because it's more infectious, we should expect a bigger challenge. And in many parts of the world, H5N1 has been a real test of industry resilience and also logistics of all involved. But in H7, if we remind ourselves what we had to deal with, 2024, 1.3 million chickens that had to be removed from the risk category. In 2025, not nearly as much, but still had very substantive effects, for example, on the egg industry. Next slide, please. So there's often a discussion about the human health risk, and fortunately, the risk to humans is incredibly low. But humans have been known to become infected, and we've been working with the Chief Health Officer and the Department of Health within Victoria to really provide some practical guidance. So people who have become infected because they've been exposed to a high level of virus with sick birds. Generally, infections have happened in countries where domestic poultry, for example, lives in the same domestic environment as humans. There have also been examples in America of the virus spreading not in a fatal way to dairy cattle, but in a way that substantially drops their milk yield. And that milk has enabled dairy workers to become infected, usually with mild eye infections. But it is one of the characteristics of this virus that it has moved to nearly 90 mammalian species, but fortunately in humans, there has been no evidence of human-to-human transfer. So the advice would be, unless you have appropriate PPE, you avoid contact with sick or dead birds or other animals. Avoid bringing their feces into poultry sheds, making sure you have clean clothing, making sure you have clean boots. If you're handling such dead birds, making sure there's appropriate PPE. And within a structured environment, making sure, of course, you follow the health and safety requirements of your managers. A regular piece of advice at this time of year from the Department of Health is to have a seasonal flu vaccine. And we are certainly passing that on. And more information can be found at the Australian Centre for Disease Control website. So just coming to an end before I hand over to my colleague, James, if we could have the next slide, please. This is, as I've said, a disease that affects commercial poultry majorly. One of the differences is it affects wildlife also very significantly. And here is a table describing some of the effects in other parts of the world. 30% of the entire breeding population of major seabirds, such as skuas and gannets in the UK, wiped out. In Argentina, almost complete devastation of some seal colonies. And in Peru and other areas of South America, and also across Asia, large numbers of birds. Unfortunately, some of them on the endangered list having been affected. So we're looking to understand the disease, where it may have got to or not got to, and that will change our approach. We know that if it does get into our native species, it would be extremely hard, if known to be impossible, to eradicate. But if it does get into our commercial poultry, we would seek to eradicate through all the strategies which are well practiced and well prepared for. But we do know that once it gets into a country, it often stays. I'll hand over to James. Thank you.
Thanks, Graeme. Hi, everyone. James Todd, Chief Biodiversity Officer in DECA. In terms of H5N1 and wildlife impacts, obviously at this stage, with no confirmed cases in Victoria, we're in a state of be alert, not alarmed, so a heightened awareness phase. And so we're working with various sectors, wildlife sector, public land managers, traditional owners, local government authorities, on how we can adopt a heightened precautionary approach, but while also ensuring that activities such as wildlife rescue, care and rehabilitation can continue. However, noting that there is currently no effective treatment for H5 bird flu in wildlife, if and when a bird flu outbreak occurs in Victoria, here's what might happen. The first thing, as Graeme's pointed out, it's important to understand that many infected animals will likely die, and there could be large numbers of sick and dead animals visible in the community. There's probably several hundred native species in Victoria at risk from H5N1, and so it's potentially the impact could be quite large. Typically, we expect that high-risk areas will largely correspond to coastal and inland wetlands and lakes and waterways, because obviously there's more susceptibility in those animals, and also if they're migratory species, particularly waders and wetland species, that's where they'll congregate. But it's also important to note that impacts elsewhere in the world, as Graeme's pointed out, have transferred into other species like birds of prey and even into mammals and the like through scavenging. And we could expect that to happen as well in Victoria, noting that obviously we're dealing with marsupials as well. We don't really know what the impact of that might be on marsupials. In terms of the response, in the event of an outbreak, and obviously with the spread potentially happening at a fast rate, the idea is to try and minimize that disease spread. And so part of the strategy for that is to look to leave wildlife in situ where possible. And of course, that's not in all cases. There may be the need to remove carcasses and the like from high visibility areas. But the issue is that in order to help wildlife populations as well as reduce the spread, we need to try and reduce the amount of human intervention and interference with those populations, so that in reducing that interference, that can help not put additional stress on wild populations that are already obviously under a fair bit of stress from the virus itself. It will also hopefully not will reduce the risk of fly-offs, from humans walking into areas where there are wildlife populations. And of course, importantly, there's also the risk of transmission to other animals in care or to domestic pets, and indeed into dogs and cats and chickens and the like. And albeit a low risk, there is a possible transmission risk to humans, noting that that's very low in terms of experience elsewhere in the world. But so the aim of the wildlife response would very much be around reducing the risk of spread of the disease, and obviously dealing with the, I guess what might be quite confronting situations for the public as well. So we fully expect that people will want to help and to act in ways that they seem to be making a difference. But it'll be important that we also, at the same time, trying to reduce the stresses on these wild populations to give them the best chance of managing through, because we know from elsewhere in the world as well that animals can survive, and that will be important to some extent in helping build some natural immunity in these wild populations to allow them to recover. I'll now hand over to Sharon Williams, who will be talking about the incident management team that's been set up.
Thank you, James. And as James and Beth said, I'm the current incident controller for the incident management team that we have put in place. I guess, I just wanted to highlight we've done some extensive work, preparedness work over the last 2-3 years, monitoring the risk that Graeme has talked about, and that has allowed us to ensure that there is a whole of government approach to what H5N1 response might look like in Victoria. It ensures that we've got a model of cover to respond, so that we've got the capacity, the capability that we need to be able to respond to this situation for us. And it's always hard to determine what the situation is going to look like, so we've done a lot of scenario working and also a lot of work for policies for wildlife management to ensure that we are prepared and are able to put them in place. Fortunately or unfortunately for Victoria, we have a lot of experience in regards to avian influenza management in the poultry sector. So we've got some really good learnings from those previous responses that we are able to bring into this new situation that we are facing. We are doing a lot of work on our situational assessments, as I said, and we're really in that readiness mode. So putting all the work that we've done into readiness, making sure it's all connected and we know where people are and how they can support us to be able to undertake what we need to do. Communication, so extensive amount of communications. It's quite a big sector and diverse sector that we are working with in this situation. So we've got to accommodate the different types of sectors that we are working with and ensure that we're able to address their needs and bring them on this journey with us so that they are feeling inclusive and that they're able to take part. Stakeholder engagement, like I said, it's really important to us that the stakeholders are engaged. They understand what they have to undertake and what they need to do to be able to protect themselves in the best way that they can, and that they are having that opportunity to be able to have input into what the different phases of this response might look like. The surveillance approach, so we've got a heightened observation surveillance approach, which Graeme has talked about, which is very much around citizen science. So quite a big area along Victoria's coastal line, inland, and so forth. And we can't be out there, so we are really relying on the community and the public to be our eyes and ears and report to us. And that's what that whole avoid, record, report is, so that we are receiving that information and we can act on it. We are doing a lot of scenario planning, which I talked about, which is our model of cover to understand, what this is going to look like in different parts of Victoria or across different sectors. We are very well connected across our technical expertise, and so we are connecting in with all the national expertise. And so Charlotte, as she explained, and Graeme are our representatives on those national committees, and they are providing that information back into us to support us with where we need to work and prepare ourselves. We are working really close with our wildlife colleagues. So we do have wildlife colleagues embedded and integrated into the incident management team, because obviously they work a lot closer and understand their sector more so than we do in the agricultural space, and also the conservation regulator, to ensure that we've got appropriate practices in place to reduce the risk. If we look at, how we're doing our communications, for us, it's a source of truth, right? And we've got national guidelines that we are feeding, and so we need to be ensure that we are tailoring them, as I said, to the different audiences that we're working with. But there are national guidelines that we need to follow, and we can't go outside of those, and so we need to work really closely with that. We're doing a lot of public information, so social media posts. We've got our customer contact centre that is set up, which is able to take public queries. And so we're updating that call centre information on a daily basis, but based on the questions and the type of information that the community is seeking from us. So we are keeping on top of that. Media queries, we go through heightened stages of media, but again, we want to utilize the media to the best of our advantage and ensure that we're able to use that to get the message out. We don't want to be responsive to the media. We want to be proactive as well. So we're doing a lot of work in that space. We are doing a whole range of these types of webinars, so across, with our government colleagues, but also with the wildlife sector, different types of stakeholders, and people are really interested in what we're doing and how we're doing it, and so we're making every effort we can to contribute to that. We're also doing a bit of to support our heightened observational surveillance. The public will start seeing signs out along high-risk areas. We're about to roll them out so that we can, again, encourage people to be that citizen science for us and report their observations through to us. Like I said, the process of our surveillance and our reporting is it comes through the customer service centre or it comes through our emergency animal disease hotline, and people are reporting that. We then go through a triage process that helps us to make decisions and timely decisions about where we need to put our efforts in regards to the reports that are coming in. So, where are the high risk species that we need to put some effort into, watching those pathways that we I know are a high risk for us to undertake our surveillance in. There is a national surveillance plan that we're about to roll out, so we're adapting that to what it needs to look like in Victoria. So that will start rolling out in the next few days. We do take field sampling, and which is sent off to the laboratory to undertake testing for us, and that's where we get the results on, the strain and the type of avian influenza that we are dealing with here. The data is, there's a quality assurance that's undertaken on the data. So we've got a whole data team that sits behind that map that Graeme showed earlier, just checking on the data, its accuracy, and making sure that we're giving timely information out, because we want that data that is shown on the map to show people where there is increasing areas of concern coming from the community. And we also use that as intelligence so that we know where we need to be able to go and where we need to resource people to be available to support the work. And it provides a daily update, so that map is continually updated. Like I said, there are a lot of people working behind in the background. So, Charlotte, I'll hand over to you, please.
Thanks, Sharon. So the call to action, what can you as industry do and how can you contribute? So next slide, please. I think really, my message to you all is your businesses and your business better than I do. However, you have got we know from H7 outbreaks. Graeme Cooke has worked in FMD outbreaks in the UK. I've been involved in Mycoplasma bovis outbreaks in New Zealand. We know that good biosecurity and early detection is key to getting on top of these outbreaks in an agriculture setting. So I think with that, the call to action for those on right now is really just, can you please look at your biosecurity plans, make sure they've been reviewed and updated, strengthen those on-farm biosecurity practices if and where needed, and just test your business continuity arrangements. We've certainly been doing that right now as we're pivoting towards preparedness plus in the H5N1 space. And then where possible, identify and manage some of those wild bird attractants or parts of your business that may be potentially vulnerable to some of those wild birds. But just reiterating that right now we still are very much in a remain alert scenario for Victoria with no entrance of H5N1 detected currently. Like we're doing, do your scenario planning, refresh and educate your staff. We will continue to run these webinars over the coming weeks as needed, and be happy to widen those out to staff if required, and just ensure that you are across what those signs and symptoms of H5 bird flu are. Review your critical reporting pathways, do those exercise if you have the ability to, and stock take on your things like your PPE, your cleaning, your biosecurity supplies, all those things that can help manage disease outbreak in general. Know your risk. I think we've talked about that a little bit, and report your unusual illnesses or mortality to the EAD hotline immediately. And then just from a traceability point of view, I think this is really critical in order to, if we do find it gets into the poultry sector, or other sectors in agriculture in Australia, is just ensuring that your information, your PIC codes and your livestock data are up to date. Again, this helps us trace as quickly and cause minimal impact into industry. Maintain those movements and stock records, and really record visitors, contractors and service providers going on and off property, so those wider tracing activities can continue. So there's some biosecurity basics information there that we can share afterwards as well, that sort of covers off a bit of this. So yeah, I think that's just the main messages in terms of what you can do as industry. Next slide, please. And then, of course, as we've talked about as well, if you are out and about outside of your businesses, please, and you see sick or dead wildlife, particularly at the moment, please don't handle or move them, and report 1-800-675-888. I'm pretty close to getting that tattooed on me, I think. Report clusters of 5 or more sick, dead wild birds or any species anywhere in Victoria, and these high risk species currently, noting that we don't have any establishment in our wildlife populations that we know of yet, are those wild seabirds, water birds, shore birds or birds of prey, and those marine mammals, seals, sea lions and dolphins. So I think that's the big message for me and our call to action. So with that, Beth, I might throw to you for any closing remarks or things you might want to finish with before questions. Thank you.
Thanks, Charlotte and team. I think we've covered a lot there. We've been talking at you for a while, and I know there's a number of questions that have been coming through in the Q&A. So I'm very happy to, at this point, we've given you our undertaking to make sure industry is across the situation if it changes, or make sure you're getting access to information that can assist you. And that just remains an open offer for further engagement as it's required. But otherwise, Dominic, I think I'm very happy just to throw to you to facilitate the Q&A so that we get around as many of them as we can in the time that we've got.
Yeah, thank you, Beth, and thanks everyone for your presentations. There are a few questions here on how long the virus is live for and how is the virus transferred. I don't know whether Charlotte or Graeme, you'd like to have a go at that.
Graeme, I think that's a good one for you.
I'm just trying to answer some questions, that's all. So it depends on the time of year. So we know the incubation period is 7 to maybe 14 days. That's in live birds. But in wintry wet conditions, it can last in feces, for example, for weeks and weeks. In hot conditions, it much shorter lifespan. But because of its infectious nature, we know it causes outbreaks in poultry in other continents and other parts of the world all year round.
Thanks, Graeme. And in terms of clothing, can it be transferred from clothing and other sorts of equipment?
Well, avian influenza is basically all about bird manure and secretions. So if you have clothing or boots that has been contaminated with that, it can cause onward spread, and we have lots of incidences of that having happened.
Thank you. In terms of a risk matrix, poultry you mentioned is up the top, and then potentially livestock or in dairy in particular. Is there, for beef cattle, is there a equal risk compared to dairy?
No. but I do have to put some brackets around that. It has shown an ability to find a way to infect to differing degrees with different consequences, different mammals. But dairy cattle in America were a particular instance, and that's because the virus adapted slightly to somehow be able to spread from dairy cow to dairy cow, mostly through their milk. But in terms of beef cattle, no concerns.
And there are a few pig producers in the audience. Are they at risk, especially outdoor systems?
So pigs globally have, talking to colleagues in other countries and other systems, I've asked that question myself because some of you will know that pigs are a particular risk from influenza, and they are what's called mixing bulls in terms of mixing with human viruses. But it has not been a major feature. So you could say this virus is behaving selectively, but significantly.
Thanks, Graeme. In terms of open range chicken operations, what would happen if there was a neighbour with a positive result or their owner operation having a positive result?
So within the commercial sector, we undertake measures to prevent further spread. So that would be movement restrictions within a control area or a risk area, and that would really be in terms of surveillance of what's going on in those flocks. So that would be more than routine testing, and also controlling the movements through a permitting system, so that if something was to happen, people know what's come in and what's gone out, and trying to join the dots. And that is one of the principles of control within poultry, is locking things down within a particular area.
Yep. And does a vaccination exist for poultry at the moment?
Yes, there is a vaccination, but it's very, very complex to apply because it's well known that the virus could continue to circulate in a vaccinated flock, and could even become a worse form of vaccine. There's also economic considerations, there's continual testing considerations, and there's also the fact that different production systems have different needs. So, for example, chicken meat are very short-lived birds, and egg laying are long-lived birds. Australia has been looking at the potential for vaccination if it was ever needed, and it's a multi-jurisdictional group that's been looking at that. But in my discussions and Australia's discussions with other countries that have had to face up to H5N1, vaccine is rarely used for all those reasons.
Right. And just on other livestock, horses and sheep, is there a chance of...
Whoever asked the question knows they're influenza. So horses do get influenza, but there's been no evidence of this virus spreading. They have their own type. And sheep, really not a problem. But however, some testing in Scotland did pick it up in some sheep without any consequences, but it was evidence that it had infected sheep.
Thanks, Graeme. James, might have a question for you here. You did mention if you do see wildlife that's sick or dead, to avoid, record and report. Can people, if they do see dead wildlife, particularly birds, can they send those in themselves, or what would you recommend?
So certainly if it's five dead birds or more of any species, or a single sick or dead bird of one of those high risk species like a seabird or waterfowl or shorebird, then certainly the EAD hotline is the way to go. if it's another species, like someone's seen an injured kookaburra or something that's a magpie or something like that, then at this stage they feel free to just call their local wildlife carer, and they'll take care of those. So we're currently working with the wildlife sector around developing some stronger guidance around that as to how they should respond as well. But if in doubt, call the EAD hotline. But obviously, if it doesn't look like it's exhibiting symptoms, if it looks more like it's had an injury, then that sounds like a standard wildlife carer response.
Right. And if there was to be an outbreak and there were a few dead birds on, say, a side of the road, you wouldn't recommend the public to dispose of those themselves?
No, I think once we've got an outbreak, then we're in a different situation. I mean, Graeme might have a view on this as well, but essentially, if you're starting to see mass mortalities in areas, then even on the side of a road, if it doesn't look like a roadkill, then that might indicate that we've got some infected birds, and certainly staying clear of those would be the best way to avoiding contact, so that you're not kind of risking transmission more broadly, and certainly not handling the birds or transporting them.
Thanks, James. And one more for you. In terms of wild animals, such as foxes, are they transmissible?
I believe so. Graeme might chime in here, but I think elsewhere in the world, scavenging mammals like foxes have been infected by the virus, and we would probably expect that to happen in Victoria as well.
Thanks, James. Charlotte, if you don't mind having a go at this one, a commercial pig farm in Victoria, besides standard biosecurity measures, are there additional precautions you may recommend to reduce the risk of H5 entering a pig farm, and maybe open that up to other types of farms as well?
Yeah, look, I think it's just touching on what we clarified earlier, is that those really good biosecurity, just make sure I'm off mute, yeah, those really good biosecurity practices. And then I think the critical part, as well as the lodging who comes on and off your property, all those bits, making it easier in terms of traceability. If you do see any sick or dead birds on your property, particularly those ones of high risk, don't move them around, call the EAD hotline and really report that in for us. I think that's probably the big thing. Graeme touched on the fact that at the minute, pigs have got their own particular types of diseases, and currently maybe not one that is impacting pigs. I think I just also like to touch on, Graeme, maybe for you to clarify as well, is that the current detections of H5N1 and its specificity in Australia is from the Heard Islands Antarctic incursion, which I believe is a different subclade from what we've seen in the berry herds in America. So just wanted to clarify that point as well.
Thanks, Charlotte. So as the virus moves around the world, it changes slightly. Influenza does that, and in America, moved to be able to infect dairy cattle. We talked about that. Heard Island has its own particular variety, and we just don't understand whether it would affect any of our domesticated livestock species. But we do know it is certainly capable of destruction within commercial poultry and marine mammals.
Thanks, Charlotte and Graeme. In terms of test turnaround time, how long are we looking at?
I'll take that question. It's a very commonly asked question, and I think we've all got used to during COVID rapid test results and things like that. It's a much more complicated business. It needs particular laboratories, particular skills, and it will not be held to any particular time, because it can take from days to many days in order to get a result that we're all happy with.
Thanks, Graeme. I think you did touch on the trade implication with other countries, but if there was an H5 outbreak on a commercial scale, what would be the implications to trade?
Charlotte, do you want to take this one? It's very much in your background.
Thanks, Graeme. Yeah, I used to work in China with trade stuff, so that's probably why Graeme's thrown to me. Thank you, Graeme. Look, what we do know is that obviously it's a notifiable disease to the World Organization that looks after international trade. As it currently stands, it has not met any triggers that impact international trade. And there is significant work underway by DEF to look at the spread of H5N1 globally and what some of those trading conditions for particular products may look like in terms of certification. But what I would say is that we have seen in the initial notification of H5N1, as we saw a little bit of a knee-jerk reaction in some of our trading partners, and then that was pulled back really, really quickly. So I think what we would likely see is, as we saw in H7, is some specific location-based restriction to trade around disease that would be regionalised. But at this stage, we are not seeing any impact to trade for Victoria. Graeme, is there anything you'd like to add to
that? Trading partners can be very risk averse, as has been alluded to, and they can be very unpredictable. But at present, there are, as you've said, no trade implications. And when we've had avian influenza in Victoria, any trade implications became very narrow once we had conducted surveillance and basically isolated it to one particular area. And we worked very quickly to get those markets back.
Great answer. In terms of potential compensation, if a poultry farm did have H5, what is there more information you can give about that, and also about destruction in general on farm?
So, Charlotte and Beth, this is very much in our sort of industry cost sharing area. So there are agreements in place for a range of diseases whereby there's cost sharing with industry, and that is really for the goal of eradication, for the good of industry. Those agreements are through signatories who come together at the beginning of a response and regularly during a response and agree to the approach. In terms of what that compensation looks like, the details can be found on the Agriculture Victoria website, and they are covered in legislation. Not the figures, that's a different process, but the necessity to give compensation is covered in the Livestock Disease Control Act.
Thanks, Graeme. I think we've got
Dominic,
through.
you did ask about destruction. So
yes.
destruction is undertaken according to methods which are approved by the Animal Health Committee in Australia, and they tend to be internationally approved methods as well. There is always a need, though, to conduct rapidly and at scale. So naturally, we use contractors in order to do that.
And one more, Graeme. In terms of early warning signs in domestic egg-laying ducks, are the symptoms the same across all of poultry?
Pretty much, yes.
I think we've had a pretty good go at most of the questions there. So I'd like to thank you all for joining tonight. Thanks for answering those questions and giving up your evening to learn more about age 5, and hopefully you found it beneficial. And yeah, thanks to the AgVic team for joining as well and for your valuable insight.
Thanks, Dominic. And if there's any questions we can get to, Dominic, we're very happy to provide some offline answers if that's helpful as well.
Thanks, Beth. And a reminder, we will send an email out with a link to the recording for anyone who missed this, as well as the slides we shared tonight. All right, I'll wrap it up there. Good night.
Thanks, everyone.
Good night.
Thank you.
I can't work out how to leave. Oh, that's okay. I found the button. Where's the button? Okay. Talk to you soon. Bye.